Kristen here at UT Southwestern Medical Center. Thank you for joining our chat on head and neck cancer. This is part of Oral Head and Neck Cancer Awareness Week, so we're excited to have Dr. Saad Khan and Thomas O'Neill. So Dr. O'Neill is a neuroradiologist with our Department of Radiology here at UT Southwestern Medical Center, and Dr. Khan is a medical oncologist at the Simmons Comprehensive Cancer Center, as well as an assistant professor in the Department of Internal Medicine. Just as a reminder, we want you to like and share the conversation as often as you can. We have some great guests here today that can answer tons of questions. We can't deal with specific medical issues, but we can certainly talk in generalities, and we encourage you to submit your questions. And we're going to go ahead and get started. So gentlemen, thank you for joining us today, Dr. Khan, Dr. O'Neill. It should be a great conversation. So I want to start just kind of the broad question, and maybe you can start with this one, Dr. Khan, and that is, what does it mean when somebody says head and neck cancer? What's categorized in there?
So it's a pretty diverse group of diseases that head and neck cancer covers. So people may be talking about cancer that starts in the tongue, or in the nasal sinuses, or in the skin of the head and neck, or in the throat. All of these get lumped in together into head and neck cancer. They're all treated the same way, but they have very specific individual treatments that we end up doing depending on where it starts from and what the patient has in terms of their other illnesses.
Okay, and so that's a good place to start. So is head and neck cancer, or the various types that you just described, is it preventable?
It is. So the easiest thing that you can do is, if you smoke, stop. If you've never smoked, don't start. Other things that people are doing are trying to prevent HPV transmission. So there are different barrier methods to do that, as well as potentially even vaccines that in the future may be able to prevent some types of head and neck cancer.
Okay, that's a great way to get started. So I want to just remind people that what you want to do is, when you're asking your question, you want to leave it in the comments field of our stream. We will tag it and pass it along to our appropriate guest. So now, just to kind of get this out of the way, a lot of people have questions. You know, the HPV vaccine, does it completely prevent head and neck cancer?
So the short answer is we don't know. So what we do know that it does is it stops some types of high-risk viruses called HPV that in decades can change the lining of your mouth and turn it into cancer. So getting vaccinated today won't get rid of the changes that happened over the last 20 or 30 years. But if you get vaccinated today, it may stop you from getting an infection that 20 or 30 years down the line may lead to cancer. So the best evidence is that people should get HPV vaccination, and it likely will prevent some types of head and neck cancer.
Okay, good to know. All right, I see the questions rolling in now. And the first one is for you, Dr. O'Neill. It's from Tony, and her question is, are there any safety concerns with the radiologic scans when a patient has these types of cancers?
Sure. So you know, any scan that we do to diagnose cancer, or make anytime we do any imaging study, we always have to consider potential risks and potential benefits. The risks are very minimal to ionizing radiation. So a CT scan does have some what's called ionizing radiation, which is scary sounding, but it's really very minimal relative to the risk and relative to the benefit that it provides in making a diagnosis of head and neck cancer, or anything in the body that we're imaging. Similar for PET scans, they also have some ionizing radiation, but in general, that risk is very low. And so, other imaging modalities, we can use include, MRI, which does not have ionizing radiation, and ultrasound also is commonly used in the head and neck for diagnosing head and neck cancer.
It was actually the next question, was to figure out, if you've received or potentially could have head and neck cancer, what are some of the diagnostic tools that you use in radiology to determine that?
Right. So, head and neck cancer is basically kind of have to look at it from the inside and from what the physician sees as well clinically. So, typically what we get is a patient that's been referred either either because something's, a lymph node is, or some, a mass or something has been felt by the clinician examining the patient, or, sometimes the patient's already been referred to an ENT and they've put a scope down to look directly at the throat, or, at the back of the mouth. And so, there's something clinically suspicious that they want to, evaluate all the other structures around what they're either feeling or seeing, and to see kind of the extent of that abnormality. And so our role, is to basically, map out that extent. So is it just a small lesion just on the surface? Is there extent into the deep spaces in the neck? Is there involvement of lymph nodes? Is there involvement of adjacent nerves in the area, or is there involvement in distant sites throughout the body? So that's kind of the role of radiology in this.
Okay, great. Thank you for asking, Tony, and thanks for tuning in. That's a great question. We have another question, and this one came in from Christy, and I'm going to start with you, Dr. Khan, on this one. And her question is, how can someone know if they need to be evaluated for head and neck cancer, and what are some of the common symptoms?
So there are good parts and bad parts of head and neck cancer. So the good part is that if you notice a lump in your neck, you're going to tell that it's there just by looking at it and by putting your hand on it. So you can detect it almost pretty early. The bad part is that it affects a part of your body that is so integral to who you are. So your face, your tongue, your mouth, all of these areas are so important to your daily function. You need to talk, you need to eat, you need to present your face to the world. And if you have a mass growing on your neck, you're usually not going to wait a very long time. So you're going to go to your doctor, and usually what they do is they send you off to a surgeon to try to get an idea of what that is. And they'll do some of the scans that Dr. O'Neill will talk about.
Okay, sounds good. And so there's a different question that's kind of related to that. Is a voice change symptomatic of head and neck cancer?
It absolutely can be. So you have to be very concerned about voice changes, but unfortunately changes in voice can happen for 100 different reasons, 99 of which are not going to be cancer. But if you had a sore throat and then it just wouldn't get better for weeks and months, and you notice some other abnormalities like difficulty swallowing or a lump in your neck, and you've smoked in the past, I would definitely get that checked out.
Okay, good question, Carl. Looks like you wanted to add something, Dr. O'Neill, to one of the things in there?
No.
Okay, just wanted to give you the chance there. All right, here's a follow-up question from Carl. What about nosebleeds? Are these related to head and neck cancer? I know my son gets them all the time. It doesn't seem like he has nosebleeds. He's just cancer. He's just sticking his finger up his nose. But for your average person?
So the average person is just like your son. So most of the time, nosebleeds are going to be related to direct trauma or sinus problems or infections or allergies, and almost never in the US are they related to cancer. There are other viruses one is called EBV that can cause cancer in this area, in the rest of the world, but it's very uncommon in the US. And so cancer in the nasal cavities is extremely rare in the US. It happens less than about 3,000 times. So if you have nosebleeds that won't get better, clearly you still need to see a doctor. But there's probably going to be a non-cancer reason for it.
Okay, good to know. Great question. Here's one from Jennifer. And her question is, does it show up in the neck all the time, or can it be in the head where it doesn't physically appear? Maybe that's me for you to start with, Dr. O'Neill.
Sure. So, there are sites that, in the deep spaces in the neck, again, as Dr. Khan was saying, there are many structures in the head and neck that we're, referring to. And so, kind of categorizing these into one disease is misleading. So there are other structures where cancers can arise within the head and neck that oftentimes imaging is the way to kind of find those that you can't feel or see clinically. So.
Okay, good question, Jennifer. Thank you very much. So here's one from Christy, and these are coming really fast. We appreciate it. We're going to try to get to all of them as quickly as we can, but here's our next one, and it's related to treatment. So what kind of treatment is available for head and neck cancer, and what are the side effects, if any, associated with those treatments?
So the treatment the most important thing that we need to know about head and neck cancer is that the treatment that we currently have is very good. And it's not just one treatment, it's a mixture of things that takes into account your diet, it takes into account your own personal health, what your preferences are. When you have a cancer that's growing in your tongue and has spread to a lymph node in your neck, that may be a stage 4 head and neck cancer, but that doesn't mean it's incurable. Almost all of the time, that stage 4 head and neck cancer can be cured. And there are different ways of doing it. You can cut it out and be cured. You can shoot high energy beams of radiation from the outside. You can treat it with chemotherapy and immune therapy. There are all sorts of different things that need to be done. But in addition to the treatments, the side effect management is one of the most important things. And that was one of the really critical questions that they have, is watching out for changes in taste, thick saliva, changes in your hearing, difficulty with swallowing and speech. So these are all things that we have you meet with a speech language therapist to kind of work on your swallowing and make sure that your voice comes back to normal, because we expect almost all of these people to be cured after their cancer. We want them to have a good quality of life after they're cured.
Wow, great question. Thanks for bringing it up. So what about this one? Is age a factor? And I've heard that it's more common in men and women, but I haven't heard as much about age.
So age is a cancer risk for basically every cancer. So pediatric cancers, cancers that happen to kids are all tragedies, but they're very rare. So they usually happen about less than 10,000 times, whereas every year in the US. Whereas if you're looking at head and neck cancer, that's 60,000 people every year suffering from head and neck cancer. And the older you are, the more chance your body has to develop some exposure to toxins or some abnormality in the DNA, and that leads to problems. So it's very uncommon in their 20s, in people who are in their 20s, but it's much more common in people as they get older. HPV cancer is one that happens to people sometimes even in their 40s, but if it's not HPV-related head and neck cancer, you might be looking at either the 60s or 70s for most people.
Okay, all right, great question, Ellen. Thank you for joining us and for taking the time to submit a question. Here's a follow-up from Christy. And we mentioned this a little bit earlier, and I think, again, this is going to be mainly for you, Dr. Khan, but is there anything people can do to prevent the development of these types of cancer?
I think the most important thing is to avoid smoking and alcohol. There's really no health benefits to having regular alcohol and tobacco intake, and that includes cigarettes, cigars, and even dipping tobacco, because that directly can cause damage. We don't know if electronic cigarettes have that same risk, but it's certainly something that you want to avoid. It doesn't give you any real benefits to it. If you're doing all of those things, the next most important thing that I would say is regular dental checkups, because something that the dentist does is they do a very thorough internal exam, and they may identify an abnormality even before you know that there's something there. And then the last, which is the thing that is in everyone's hands, is to pay really close attention to your body. If you notice, as one question said, a change in your voice, or you're noticing a difficulty with swallowing, or you're shaving and you notice a lump in your neck, don't just ignore it. Don't just say that it's going to go away. Go to your doctor. Almost always it's not going to be cancer, and you'll be reassured. But if it is, unfortunately, going to turn out to be cancer and you identify it early, you may be able to get it cured very easily with very low intensity treatment.
Okay, good to know. Thanks for asking that question. That was a great one. What about for you, Dr. O'Neill, and this came in from Carter, have there been any advances in diagnosing head and neck cancer?
Sure. So, the imaging modalities that we're using are have been around for quite a while, and there are certain advances in specific techniques that we do to image the head and neck. We could get into some very specific kind of details about the reconstruction of the image algorithms to avoid the dental artifact, and there's some very specific things that we do to try to optimize imaging, and so there's other techniques in MRI that we're using, but the mainstay is going to be is CT scan of the head and neck, and ultrasound, and then MRIs in certain scenarios, and PET scans are also very, very common to evaluate extent of disease throughout the whole body. But there are advances. It's just, in general, we stick to what's tried and true, and we've made adjustments to some of those tried and true methods to try to optimize our imaging.
Perfect. All right, great question. Thanks for bringing that up. So we've got one here that's related to a celebrity. It says the late film critic Roger Ebert had oral cancer. It was very well publicized. He had to have portions of his jaw removed and eventually was unable to speak, unfortunately. The question is this a common prognosis for those who've received this sort of diagnosis?
So unfortunately, it can happen that people can die from head and neck cancer. Most of the time, if it's detected early, you are going to be cured from it. So as I mentioned, every year 60,000 people with head and neck cancer get diagnosed in the US. 13,000 people die, which is a huge tragedy, but that still tells you that a lot of people are surviving with the treatments. And treatments have only gotten better. So since I've been treating cancer in the last 10 years, the entire field has changed. So now we're using immune therapy. So these are drugs that train your body's immune system to help identify and destroy the cancer. They have very low side effects, and they work quite effectively. So someone like Mr. Ebert or any other celebrity with head and neck cancer or anyone who comes to our clinic will always be screened for immune therapy treatments, regardless of whether it's early on or later on. We have clinical trials that can keep the cancer under control for longer using these exciting new drugs.
Perfect. Well, thanks for the question. That was definitely something that's been in the news a lot lately, Carl, so thanks for bringing that up. So, question for both of you, what are the benefits of somebody who's received a head and neck cancer diagnosis coming to UT Southwestern? I assume it's partly because you gentlemen work together, you're part of a large team. How would you explain it?
I think there's a very kind of comprehensive group that gets together weekly, actually, even to discuss these patients and provide a comprehensive plan for the patient. And I think that it's a very collaborative experience here amongst all of us to provide the best patient care that we can.
So I think this is a really important question, because when we're talking about cancer treatment, you want to do it once and you want to do it right. And it's a big deal to put your life in the hands of a doctor and say that whatever you tell me I'm going to do. And even if that means driving 5 hours to come into Dallas and deal with the team here. The benefits of coming to a place like UT Southwestern are that we have a very advanced head and neck cancer treatment and research program. So I co-lead the head and neck cancer research program, and every year Southwestern sees roughly about 700 new cases of head and neck cancer, which is a huge tragedy. But it also means that we have specialists that all we do is treat head and neck cancer. So even if someone is dealing with it or learning about it for the first time, we've probably already seen it. And we've probably already dealt with it. And we may even have very specific clinical trials, regardless of how uncommon your disease is. We may have the expertise for it, as well as the cutting edge next generation therapies that may treat it even better. So we often find that people are coming from even 5-6 hours away. We have an airport right nearby. They fly in and come to our clinic. And it's a big deal that they choose to trust us with their care.
Absolutely. So related, what recommendations do you have for family members, caregivers, loved ones of individuals who've been diagnosed with head and neck cancer?
So I think they're the real key for getting a good outcome in head and neck cancer. So something that we say in the head and neck cancer clinic just down the hall here is that if you have a good why to live, you can endure pretty much anyhow. And when I see people come into clinic and they're surrounded by their family members, or tell me that they're on the phone or they want them to do well, they're sending their prayers, I know they're going to do better because they have a reason to keep fighting, a reason to keep living. And no matter how advanced our science gets, the spirit is really important. Having a religious conviction really helps patients get through it because they know that there's meaning to their suffering. And so family members, when they provide support, when they are advocating for their patient, when they come in and ask important questions and are a second set of eyes and ears for our patients, they make all the difference in the world and they make the outcome better.
All right, great question, Christy. Thanks for bringing that up. So we are almost out of time. We have time for maybe a couple more questions. One kind of for both of you is, you talked a lot about what happens at your UT Southwestern. We also have a large support team in place to help cancer patients, correct? Can we talk about that a little bit?
So it is a way for survivors of head and neck cancer to reach out to those that are undergoing the treatment itself. So it is, it's very hard when you're starting out to treatment to really imagine a day that you're going to be cured from this head and neck cancer, but it really does happen. And so we have an advanced survivorship program that after you're done, we still want to follow up with you. We still want to find out if there are any after effects of treatment that you're dealing with, and we want to connect with your other doctors who may not be as familiar with the after effects of head and neck cancer and its treatment.
Okay, sounds great. Great question. All right, looks like we have our last two questions. One came in from Carl, and you mentioned risk factors like smoking, HPV exposure, age. What about sun exposure? Is that also a risk factor? And what about cosmetic injections like Botox, fillers? Are those also risk factors?
So we definitely have some risk factors for sun exposure for very specific types of skin cancer that occur in the head and neck region. There, it's really clear advice, just try to avoid sun, use sunscreen, wear a big hat. Things like fillers are less clear. There isn't a strong association with cancer, but it's possible in the future we may identify something.
Okay, all right, great question, Carl. So I think we're gonna have to wrap up for the day. This has been a wonderful slew of questions. Thank you all for tuning in and for participating. As always, the chat will be here on Facebook afterwards. We're also going to post it on our YouTube channel this evening. So if you have friends and relatives, for whatever reason, aren't on Facebook, please send them to YouTube. It's a fascinating discussion with a really important topic. In the meantime, though, I want to thank both of you for joining us. Dr. Khan, Dr. Emil, your advice and guidance has been invaluable, and thank you for taking the time.
Sure. Thank you.
All right, have a great day.